We definitely had the vision. From the vision, we did the county integrated development plan. From that, we used to draw from the CIDP to the annual development plans. Then again, we came up with systems of ensuring that we did things right. For example, and working with other departments, especially the Department of Devolution, we developed the public participation model that made us work with the people to agree on what they needed.
Thank you for tuning into today's podcast. Today's guest is Mary Kimanzi, the former CEC Finance of Makueni County, one of the most progressive counties in Kenya. Welcome, Mary.
Thank you.
How are you doing today?
I am well.
It's absolutely wonderful to have you on this podcast. Now, I wanted to ask you as a first question, because, Mary, you and I, we worked together previously in a capacity of building capacity for your staff within the Makueni County on top of the capacities that are already in-house. I wanted to understand what was your experience being a CC, and what does it mean to be a CC in the county? Actually, and from the perspective of what is your day-to-day activities, what are the pressures you face? I know a lot of counties come for benchmarking in Makueni because it's so progressive. You have a lot of development partners that are also providing support. How did you manage your activities as a CEC? Break down a day in the life of a CEC for us.
Okay. Thank you so much for that question. Let me begin first by defining, the work of a CEC generally. The work of a CEC and a CEC for finance is well defined in the Public Finance Management Act. The CEC for finance is actually the head of county treasury. And the CEC is supposed to ensure that there is adherence to the Constitution, to the Public Finance Management Act, and any other act that is bringing out issues of management of finance, and also to ensure that people adhere to the national values as set out in the Constitution. Generally, the CEC is supposed to ensure that the public finances are well managed, and also the economic affairs of the county. They ensure budget is prepared. They ensure that, there is a way of ensuring budget is being well implemented, that there are plans in place that are being followed, that there's compliance with standards, that the reports are produced that show financial position. Such reports are forwarded to the auditors, who will come and check whether everything was okay. Any funds that are developed by the county government, such as the emergency fund, the county revenue fund, and any other fund that a county develops, they ensure that they are well managed, and they also manage other county government entities on matters finance. That's from a technical point of view. Administratively, they are also, given a responsibility by the PFM. The CEC for finance is supposed to ensure that everybody is managing finances as they are expected of them. And so they become a supervisor of everybody else in the county with regard to management of finance. And they ensure that all the accounting officers designated, and again, it's the role of the CEC to designate accounting officers. An accounting officer will be responsible for managing, the resources that have been allocated to their entity. So administratively, they designate accounting officers and they supervise them. A CEC will require an officer to account for what they are doing. And of course, with prior permission, they will inform an entity that would like to come and inspect what you're doing. Like if they are not happy with what is happening, they kind of link the government with the people when it comes to matters money. And how do they do that? By ensuring that the people participate in decisions that are made for them. They participate in the plans. They participate in the budget. They participate in the finance bill. And they get involved generally in all the plans that are being established on their behalf, including the budget. Of course, the CC delegates to other people because they can't be all over the place. But when it comes to answering for what has happened, a CC for finance takes responsibility. Actually, when the auditors come to audit a county, they will look at the CC for finance as the main officer being audited. And that's how, we end up to the Senate to respond on questions raised. Of course, the governor appears there as, like, so to speak, the person to answer the questions, but the CC for finance supports all entities in making that response. So they end up to be the main person to ensure finances are well spent, they are well managed, and they are well accounted.
And how does it, and I know, like, and as you said, it's very well described within the Finance Act and within the Constitution. But what are the things that you experience that you did not expect to experience? We talked about, for example, the budget needs to be prioritized and negotiated. What are some of the challenges that you face that perhaps people may not know about?
I'll talk about the challenges I experienced, but just before that, you actually asked me a question like, what a day looks like to a CC.
Exactly.
Maybe I could respond to that first. You wake up to manage the affairs of the department, to respond to issues coming from other departments, to respond to the public that come to the office with questions, to attend meetings that have been prescribed, and even impromptu meetings. Sometimes you wake up with a planned day, but you end up doing other things because of the political environment. But generally, a CC will ensure that they respond to questions that are coming up from the staff, especially on revenue. I would spend the day maybe responding to revenue issues, looking at what needs to be done. Sometimes I would even visit the revenue collection offices, and sometimes I would also go to the market to see how collection is happening.
So you're very hands-on.
Yes. I had to be hands-on because if you want to understand a system and help it improve, then you have to be present and hands-on to be able to improve it. Look at reports that are coming up, planning reports, implementation reports, looking at cabinet papers. In Makueni, we used to prepare cabinet papers. I believe they're still being prepared, which would then design a project, saying what the project it is, how it is going to be done, how it is going to be achieved, what will be the benefits. So generally, you spend the day busy reviewing papers, looking at the procurement plan, is it being implemented as expected? Looking at, generally the work that is being done in the department, responding to questions by people, responding to letters from departments, making requests, following up funds, ensuring people get funding in good time, and, all those things around the management of the office as defined in the Act. So that would keep one busy. Sometimes you look at one or two reports. Sometimes you end up in the field, following up what is happening out there. When there are public participation meetings we attend, I used to schedule all the CECs and the accounting officers to be in charge of certain centers so that we have someone senior enough out there talking to the public and getting data. So the day would be very busy. Actually, I think it's one of the busiest offices in the county. Sometimes I found myself working late, waking up to the office early. Sometimes I would go to the office before 8, lock myself in, so that I would review the documents ahead of everyone else. Because when everybody comes to the office after 9, people want to see you, they want to talk to you, and that's how we used to manage it typically. Now, let me come to the challenges and I think the question is, the biggest challenges I faced. The budget process was not easy. With limited resources and a lot of, competing needs. And genuinely, I would appreciate the pressure from departments, the pressure from...
You would appreciate it?
I would appreciate that they mean good, but it would be sometimes stressful. Because some of them do not understand. Some think that you're just denying them funding.
They don't see the whole picture.
Yeah. And what we normally used to do is make a proposal with a theme, like the theme for the year could be to promote water. That means we'll be looking at how we direct most of the resources. Of course, in coming up with a theme, we are looking at the previous year. How did we perform? How can we better this year? So what is the greatest need? So can we now measure on water or health or whatever it is? So now when we make a proposal, it would look like that department is more important than the other. And so the argument begins. We also need to do this. We also need to do the other. So that was not an easy process. And it would, take a lot of negotiations to be able to agree with the departments on what needs to be done, what can be delayed, and how can it be done better. So that's what used to give me some of the challenges. Also managing the politics. The politicians also want projects, and they want projects maybe, in their places or certain places, because you see, they also make promises when they are coming to power. And so they want the people to know that, they are managing well and they are giving them projects. So again, you have to balance. But we were also able to manage this better, especially in the second regime, because we got the politicians to understand that they can work with the people. And so they went down, discussed with the people, came up with projects together. And so that process becomes easier that way. But again, that wasn't easy. And of course, collecting revenue. Sometimes I would get a call, even from a politician, like, this person in such a place is being harassed by your revenue people. And when you follow up, you find it is not harassing really. It's just someone refusing to pay, revenue. And, someone will make it look so bad, like you really have to sack that officer. So those would be not so nice moments. I would talk to my staff, of course, ask them to be fair with the people, but just to make sure that they collect the revenue. Those, I think, were most challenging moments for me as a CAC. Yes.
Was it ever difficult to manage also development partners? Because I know, Makueni is what is known as a donor darling, where donors are always, they're attracted to counties that are doing well, and they want to support those counties to continue to do well. Did you ever have a challenge managing donor attention?
I would say we didn't have a challenge, because we realized the need for a donor liaison office, which had a director. So the director, we would direct all the requests to him. Of course, all communications would come through the office of the governor and the county treasury. And so then the director would schedule them so that, we have time for each one of them. So when they come and report to that office, then a meeting would be organized. Of course, they would report earlier before they come, so a meeting would be planned, and we were able to schedule them well. So we didn't have a challenge of them, meeting there, all of them at the same time.
That's probably a model other counties can borrow, because sometimes managing different needs from different stakeholders can be challenging. But that sounded like a model that works very well.
Yeah, and what I appreciate from the donors is that, of course, some of them came knowing exactly what they wanted to do, but other donors would come and work with us, like, what do you guys want us to do? Of course, they would be specific, like in water or in health or in agriculture. And so it was easy from our county integrated development plan, drawing from the vision, we could then agree, this is the project we want to do, or this is what we want to embark on. So it was not difficult. I think that office really helped us, and departments were meant to understand of the need to bring up everything at that office. Initially, Some of them would even want to reach out to departments. Yeah, like it's an agriculture project, they want to work with agriculture. But with that office, we were able to bring everything together. And the leadership through the cabinet, the county executive committee, made it clear to everybody that if everyone talks to you, they want to come to do a donor project, let's direct them to that office and let's work together so that we have coordinated development. So that way we were able to manage them well.
That's an excellent innovation.
Yes.
So during your tenure, Makueni was and it still is a star performer in public service delivery. What were you able to do within your docket under finance to facilitate this? What was your secret sauce to make public service delivery runs relatively smooth?
Like I have told you, we definitely had the vision. From the vision, we did the county integrated development plan. From that, we used to draw from the CIDP to the annual development plans. So we developed policy documents that aided in development. Then again, we came up with systems of ensuring that we did things right. For example, and working with other departments, especially the Department of Devolution, we developed the public participation model that made us work with the people to agree on what they needed. That way implementation becomes easy. The people asked for it, we budgeted for it, we have funds for it, we get to do it. Again, we worked with the people. You've heard of Makueni project management committees. These committees are comprised of the community, people that live in the area where a project is being done. You see, this way, we also get confidence from finance that at least the people know a project is happening. And because we may not visit all the projects, it becomes confidence to us that that project is being done. When it comes to paying for government projects, there's normally laid down procedures, like there has to be an inspection committee, there has to be an engineer certified. But suppose they are corrupted, they would lie. But the community cannot accept to be corrupted. It is an hospital, they want to see a building. So whether you try to go around it, the community has to take. And so we actually made the community confirmation document part of the documents to pay. So that administratively from the government perspective, these documents are confirmed, but then again we have the community document to confirm that it's done. And because we empowered the community and allowed them to access even the bill of quantities, then they wouldn't allow contractors to mess. You would imagine some of them are graduates telling the contractor, this is not the material. You have to use the material that is mentioned there. But they know these things. If it's about the metals being used, they know them. So they would be able to do that. So this way, we were able, to get projects implemented. Again, training of staff, and we got support from World Bank through the Kenya Devolution Support Program. Staff were trained on how to do budget. We were trained through program budgeting. We were trained through, assessing how to ensure that the project being done is actually, what is the word I'm looking for? That it is worth doing, that it is worth doing, that
value for money,
value for money and all that. We learned how to do that so that in budgeting, then we would ensure that the monies allocated to a project are also adequate. Initially, before the training, we did projects that were incomplete. Then the next year we would be adding money and adding money. But with that training, there was quite an improvement, and projects would be done to completion, or even if there was a variance, it would be minimal. So that way we were able. And then of course, we established many systems of transparency. We established a system of open contracting. Open contracting ensures that whatever projects you procure are well defined and the process is open to the public. So a system where the public can go in, know how many people quoted, how much they quoted, who evaluated, who was the winner, who didn't win and why. That way, again, You make the system open, making it easy to implement. True. We went through open government and ensured that, most of the things that we do are open. So let me talk of really ensuring the values, as mentioned in the Constitution, are embraced in the county. Openness, accountability, inclusivity by ensuring we include people, equity, and all that. Those are some of the things that helped us to do it better.
So, Makueni County launched the health financing scheme called Makueni Care in 2016, which provides registers households free public health care, free services within the public hospitals. What were the gains and challenges of this system in financing this healthcare system? And do you think other counties can also adopt?
Yeah. So the Makueni Healthcare is a program that was developed to help the people access healthcare. What we found is that we were collecting like 100 million from the community through what they paid at the hospital. And then the question was, can we raise the same money in a different way and give this healthcare? We agreed that from the households, if each paid around 500 shillings, we would actually get 100 million. And that way, we would give more people healthcare. And so we discussed with the people and we rolled out that model of healthcare. Although not everyone got into it, even up to now, I think, though it has improved, there's quite a lot of people in the program, but initially they were few. Of course, as they saw the benefits, they began to appreciate that they could join. But what we noticed is that now, with that kind of a scheme, a lot of people were coming to hospital. And so we can say some of the gains are, that aspect of removing the barrier of accessing healthcare. Like I couldn't go to hospital because I could not afford. But now with 500 shillings, I can go to hospital, see a doctor, get medication.
Just your whole family.
Yes, it was a household fee. It was a household fee. And it improved that health-seeking behavior. Like people don't just swallow Panadols at home. Yes. They can at least go to the hospital, explain,
and find out what the issues are.
Yes, explain to a doctor. And of course, they reduced that burden of people spending so much. Like you imagine somebody is going to hospital, they have been admitted, now you are sick of the bed, any other lab expenses that they have to go through and all that. Then, of course, it led to a healthier population, we would say, because when more people access to, the service, people get healthier. And so when you look at the poverty index in Makueni, it was at 64 in 2013, and by 2022 it had reduced to around 35, meaning that more people now are healthier, possibly from it, of course, among other factors, and were able to invest. And of course, we managed to reduce the poverty, levels to that level. Some of the challenges, of course, and the main one is the financial burden to the government. We invested over 30% of the county budget in healthcare.
30%, a third of the budget.
Actually, 36%.
Wow.
We went up to around 36%. Sometimes the department would be almost demanding for 40%. Wow. And we had to bring them down until we couldn't bring them down anymore because we could see the need. But imagine, even with that 36% budget, 70% of it would go to recurrent budget, to pay workers. Actually, the payroll for health workers is like half of the entire county payroll. That's how the burden is. And yet, you would find some dispensary with only one, officer to manage. That is at least one who can treat. So there was that challenge. Many people came to hospital, and so the burden became more. And we had to look for how to ensure that there is continued funding so that the hospitals do not get overwhelmed. So that is the very biggest challenge that we got into. And so we had to think of how then do we improve. We had to talk to the people so that we enhance it from 500 to 1,000. And given that NHIF is 6,000, I still think people can do better than that. Because remember, it's a household. It's not an individual.
Exactly.
It's the whole household.
And that's an annual fee.
And it's an annual fee. So I think we were very generous with the people. And it is good because a government is supposed to take care of the people. We wanted the people to have it better. But we could probably, or the county could probably think of how to talk to the people and invest slightly more so that it's continued.
And how did you perform over COVID? How did Makueni Care perform over COVID? Did you have challenges, financing?
Over COVID, we managed fairly well, probably because of the investments we had made earlier into, healthcare. Because you see, like oxygen was very expensive, but we had already an oxygen plant, and it was generating oxygen. So imagine if you had COVID and you're covered by the scheme, you got treatment for free.
Wow.
We had developed an ICU and of course got some funding to improve the ICU. All patients under the Makueni Care, were treated for free. We were also able to establish a COVID center so that all COVID cases would be handled there. And we were able to put professionals there to run it and also to ensure that there were adequate drugs and other commodities required. So we managed very well. And you had asked a question whether other counties can adopt this kind of a scheme. I should say at this point, yes, because when you adopt this kind of a scheme and, the people also make a contribution towards it, who knows, you're likely to generate more funds that can be able to support healthcare better. And besides the 4 counties that are supported by the national government, I think there are other counties that have been able to start these schemes. I understand Kitui has, understand Kirinyaga has, and of course implementation is at different levels, and I don't know who else may have started, but it's a scheme worth pursuing. It enables people that are low in the society in terms of their incomes be able to get health care like anyone else. You can imagine that doctor at the county level, is the same doctor treating elsewhere, possibly in a big private hospital. But imagine without finances, someone would miss such an opportunity.
Very
So it is the way to go. I think there should be coordination between the national government. Maybe there should be better talks between the national government and counties.
Exactly. I mean, even learning with universal healthcare, there's a lot of learning that can be done from Makueni Care and the others.
And like if, I don't know what discussions we could have, like if we ensured that all the functions are devolved as per Schedule 4 of the Constitution together with the funds. Because the other question we ask ourselves is, has healthcare been well costed? Do we have adequate funds at the county level? Did all the money follow the functions? So are we getting the service as we should?
Which is a very valid question, because sometimes health budget at the national level remains quite high. So the question is really whether that is happening.
And I imagine they are doing administrative things. Maybe they are also supporting counties. Sometimes we also see the machines coming from the national level. But the question is, do they know the machines we want? So that they don't bring us what we don't need. So then sometimes I talk like I'm still in the county. Forgive me. I was there for quite.
You were there for a long time.
For quite a long time, and possibly because I also have a passion for managing finances at that level.
I remember that very clearly.
I keep feeling like I'm still there. So the thing is, monies should be able to follow the functions. So that question remains, did TA complete their work, or is there something that can still be done to ensure that money follows
Well, actually, it's good you said that, because even the Intergovernmental Technical Relations Committee are supposed to be continuing the work of the TA.
Yeah.
And so hopefully and I do know that that continues to happen. So I think the counties could continue agitating for that.
Yes.
But related to that, adjacent is the issue around budget transparency. And also you talked about participation, which Makueni has had a significant success in engaging citizens, ensuring that they're part and parcel of the budget process, but also being transparent. And I saw in the 2022 County Budget Transparency Service, Makueni scored second, right? So why is transparency so important? Why is participation so important? Is it just a checkbox that, you know, the budget cycle says you have to do engagements, you just tick and go, which many counties, truly speaking, do? Or do you find actual benefit in engaging citizens and in being transparent?
Transparency builds confidence. When you are open, you kind of give the other party the opportunity to trust you. And I think that's where we begin. We wanted the people to believe in their government. We wanted the people to know that their government means good. And that's why our county, even before many others began, in 2013, did a participated CIDP. Trust me, in 2013, ideas were collected and the first CIDP was participated. The budget was participated from the start. And of course, we were lucky to have a governor who understood the constitution, having participated in its making, and had worked with the civil society. So he kind of understood, so led us very well into those things, even before we clearly understood them. So by the time some of us joined them in 2014, they had already done participation in CIDP, participation of the first budget, which of course you remember had issues with the MCS, and you know, projects were being implemented. So we valued participation, and transparency has been part of the county and in the things to do, besides the fact that it's a value that needs to be embraced. Of course, some of the documents that the civil society advocates for, and the documents listed, especially by IBP, who does the budget survey, are documents in the PFM. So they are documents that a county or a government should be having even before they are posted. So when they're asking us to post the budget, the quarterly implementation budget, I mean, it's not that they are telling us something new or just a box to tick. It should be there. The annual development plan should be there. The approved budget, program-based budget should be there. So yes, definitely you have to tick a box, but before you tick the box, you are supposed to ensure these documents are there for public finance to be managed well. So it is not just a box to tick. It is something that is good to do, is in the law, and it is what makes the work easier to manage.
Let's move to digitization. We've seen it to some extent with IFMIS and processing of payments, and the Hyperion module for the budgets, GPay. We've seen it with revenue collection systems, although there are still challenges with that. I think there's some efficiencies that have been made. Can you speak towards the opportunities that are existing for digital PFM to enhance service delivery?
Let me talk about IFMIS first. IFMIS has been supporting the counties very well on the expenditure side. The modules that are there have been able to help us do a few of the things. For example, budgeting, we've been able to do it well. Financial reporting, we've been able to do well. But the system has not been able to do revenue. And I understand the national government is trying to come up with an integrated revenue system that can be used by all counties.
You think that's a good idea?
Yeah, it's a good idea. from a finance perspective, maybe politically may not be good because everybody wants to run their system, but from a financial management point of view, it's a good idea because the government will be able to know what's happening all over. They can be able even to do integrated reporting. And if we go integrated reporting one day, then we will need a system from where we can report all revenues of the government and report all expenditures of the government. So there's a lot probably that can be done to improve. For example, in IFMIS, you cannot do financial reporting to the end because the templates being used are outside the system. So there is an opportunity. Can we get a way of customizing or ensuring these templates become part of the system and they can be fed by IFMIS for ease of reporting? You hear some companies in the private sector where the year ends today, tomorrow they can give you financial statements. That is not so in the government because there is a bit of manual intervention to ensure that the data gets to the templates and gets reported. So we could think of how to integrate these templates that are prepared by the Public Sector Accounting Standards Board, and I sit in the board, where you can be able to get this data moving to those templates in a way that is faster and would make reporting a little bit easier. The same way with the revenue. And before I leave expenditure, you've had this thing of going accrual accounting, which is good for the nation. Accrual accounting is where, county governments and other government entities get to accrue their expenses, get to report everything.
As opposed to cash basis.
Yes, as opposed to cash basis. And one of the biggest challenges we understand, which may be something we need to overcome for us to go accrual, is actually to get IFMIS to work in an accrual way. We hear, I may not have the facts, that initially IFMIS is supposed to be accrual. We made it cash. Now we need to go back accrual. So there's an opportunity there to help us make IFMIS work.
And actually, we're part of the developing the new standard chart of accounts, which now should go into the accrual basis. So that is ongoing.
So that is another area that possibly needs to be worked on. Then some of the modules in IFMIS that are not working needs to be woken up. For example, a module to manage fixed assets. It is not there.
I know you're passionate about that.
Yes, I am. I'm passionate about it as an accountant.
Your accountant hat is
bits for the assets. So I would really love to see what the government wants. You'll be shocked.
Which is why it's important to have accrual, because then you can factor in depreciation of assets and
yes, including assets. And another thing about accrual is including the bills. You see, like now a year ends, the budget lapses, and so whoever is not paid becomes a pending bill. And you have had this story of pending bills all over. But with accrual, you are able to accrue that customer in the system. They are known. It's not a list. A pending bill is just a list of expenses. But when you accrue, that person is part of the system.
Yes, exactly.
And that way you are able to report, the debts better. Yeah.
Now you talked earlier about your role as a CC Finance, and a lot of it has to do with going out to the field and doing a lot of this work, which implies that there's a lot of governance, leadership, negotiation skills that you have had to employ. Linked to that, then that implies that you have to have a strong team with strong capacity in budget making, in procurement, in accounting and reporting, etc. Can you speak a little bit about the capacity the county has to deliver this work, and whether there are any capacity gaps from that perspective?
With regard to capacity at the county, I would say there's an improvement. Where we began, we didn't have much of it. There has been capacity building over time. Counties have also recruited staff, but I wouldn't say it's perfect or it's 100%. At the technical level, say directors, I find the recruitment very technically strong, if I may say. Because if I am recruiting a director for agriculture, I'll ensure that that director is actually having the right qualifications. But probably at the political level, there could be appointments that are maybe not technically backed in some of the cases, not all of them. But for finance, I must say that what I have observed is a lot of governors want to ensure that the person in charge is well versed with financial management. They have actually financial management qualifications, or even people that have done economics or finance backed degrees. But of course, it doesn't worry much, because even if someone has done something different and they're able to understand the law and implement, it can really help. But it will be a good thing if public finance offices are managed by people with qualifications of public finance, because this way then one has not only the passion but the understanding of what needs to be done and the expectation. But let me say, there must be a gap still to fill with regard to training people to understand devolution, to understand public finance management from a devolved point of view, because some of the people that were devolved from the defunct local authorities, the national government, may also be having gaps, and also people that have been recruited that may be having those few gaps. So yes, there is a gap. Maybe we have improved over time, but there's still some space to do some improvement.
Okay.
Yes.
Now, my last question, and even as we're going to the last question, I wanted to note that it's really encouraging to see a county perform so well. And then you talked about revenue, and revenue, I think about 5 years ago, was about 216 million. And in 2021, 2022, we saw it go almost 3 times, rise 3 times to almost 750 million, which is quite remarkable. So it just speaks to kind of the strength and the capacity that you have in the county, and the commitment to really increase the revenues, especially in a like a current context like today, where we have a recession and there's a very tough kind of economic environment and not much revenues, right? And we have big debt payments. For the county to raise its own revenues and to continue to reach its targets, I think it's very, very important. But my last question is related to policies. Your experience in Makueni as a former CEC and its progressive nature, but also from what you see, what is happening in other counties. If you were to pick out 2 to 3 main points and say, counties should be focusing on these 3 main areas to improve PFM, to be able to unlock public service delivery. These are the 3 things I would advise the counties and the nation in general to do to unlock the potential of the county.
Now, regarding revenue and the improvement, and again, it is not easy to collect, let me say, because everybody wants to run away from tax. No one wants to pay tax. If we all had a way of avoiding, we would make sure we run away very fast from it. And so not an easy thing to do. But some of the things we did, we developed a database of our businesses. I am sure it's not complete, but that effort has been there. Even by the time I left, they were still registering. And you see, again, businesses are coming up, others are closing down. And so we developed that kind of a database, which helped us know that we could actually reach out to more. We worked with the business people to show them that when they pay, we also give service. So like they pay, we have done a market. They paid, we improved on the infrastructure around the market. And so they were able to appreciate, we cleaned the markets, that they were able to appreciate that when they pay tax, services come. So winning their confidence to ensure that they work with us was another thing. They participated in the finance bill, which actually sets the rates for what needs to be paid as tax. And so they were able to see that, whatever we are doing, we have been able to work with them, and they appreciate that very much. So we also developed policies to help us manage on-source revenue well and to be able to improve it. But some of the revenue streams that improved quite a lot were that single business improved a bit. Okay, maybe not so much, but there was improvement. Property-related revenue also improved. That is where we get money from people doing constructions in the county. Probably we were not managing it well. We were not enforcing it well. So there is an aspect of enforcing, and enforcing doesn't mean force. It just means coming up with ways of preventing leakages, like getting people to know what developments are happening and, getting those people doing those developments to be able to pay their taxes. But again, we discovered that there was an avenue to raise revenue in health. How? Like there are people covered under NHIF who would come for services. We discovered that actually NHIF could pay us.
It's reimbursable.
Yes. And so we encouraged that. And I think some of the major improvement in revenue has come from those revenue streams. We also kind of exposed what used to be collected at the county hospitals level. Although the hospitals are not happy with it, and to some extent I kind of agree, because you see we took their facility improvement fund.
The FIF, yes.
Yes, and we made it also part of our revenues because they are collecting that money there. They were collecting and using it there. But we have taken that money and made it part of the main revenue.
So it's used for general budget support. It's not only used for hospitals.
No, it goes back to the hospital, by the way.
But it has to go
But the
through.
challenge is managing it, because you see, when there are delays in disbursement of funds, the hospitals can suffer. And you see, like, you cannot tell the hospital there is no money and the ambulance needs fuel to rush a patient to hospital. So they needed that money with them to be able to take care of those little things as they come up. So maybe a discussion can be done. And by the time I left Makueni, we were developing a facility improvement fund to be approved by the county assembly, so that then we can have the funds resting with the hospital. So there are ways of going around it so that it makes it easier for the hospitals to be able to work on it. But those are some of the things that we worked on, and the revenue improved, and I believe there's still space for improvement. Yeah.
That's fantastic.
Thank you.
Well, Mary, it's been a real pleasure to talk to you. I've always been curious about how you have been able to, how you were able to do your job, and I know you've handed the baton to the new CC Finance, and I know there's going to be, from what you've been able to set up, there's going to be a lot of progress. So I want to thank you so much for being here today. I hope you come back with us soon, give us some more insight. But I wanted to say we appreciate your insight. Thank you.
Most of the contractors, Chinese contractors, would repatriate the money back to China. So on paper, payment has been made. Transactions have taken place, but money has not hit the person's pocket. That's why at that time, people are saying we can't eat roads, because people are feeling, yes, we can see high quality roads, but we can't feel currency in our pockets, because when you have money in the private sector, whether it's the mama mboga, whether it's a corporate CEO, everybody, most people feel that growth.